Good morning. My name is Dr. Sharmaine. Can I get your name and also your age?
My name is Kausa. I'm 22 years old.
Okay, Miss Kausa, is that okay? So what brings you here today?
So I've been having diarrhea for the past couple of days,
Okay.
and it's not getting any better, doctor.
Okay, I'm sorry to hear that. So, when did your diarrhea start?
I think it was about 2 days ago.
2 days ago. How often are you having diarrhea each day?
About 5 to 6 times a day, doctor.
5 to 6 times. And how much stool are you passing each time? Is it like a lot or is it like in a small amount?
I think it's quite a bit, doctor.
I see.
I mean, sometimes it's in large amount, sometimes it's quite less than that.
So what does the stool looks like? Macam, is there anything unusual about the color ke or the consistency?
It's watery and a bit yellowish.
Okay.
But I feel there's no blood in it, and also there's only just, I think, just a little bit of mucus.
Mucus. Okay. So has the diarrhea been like explosive? Macam you cannot control it?
Because I have to like rush to the bathroom.
Yeah,
is
yeah,
it?
yeah.
Oh yeah, it's been pretty explosive. Every time I have to go, it's like an emergency. I have to
Okay.
get to the bathroom really fast.
I see. Okay. How long does the episode, each episode last?
It doesn't last that long actually. Only about a few minutes.
I see. A few minutes. Okay. So is the diarrhea come like continuously or you just come and go?
Continuously throughout the day.
Continuously throughout the day. Alright. So do you think that the diarrhea could be related to the meals or like does it get worse after eating?
I notice how it gets really bad after I eat.
After you eat?
After I eat, yes, it's much more worse than after I eat,
I see.
especially after lunch.
Especially after lunch. Okay. So have you been noticing other than after eating anything in particular that worsen the diarrhea? Like if you're stressed out, or is there any food that you might worsen the diarrhea or anything else?
I've been eating outside a lot. I feel like
Okay.
that could also be a reason. I've been eating outside food quite a lot lately.
I see. And it does make the diarrhea worse?
It does make the diarrhea worse actually. Yeah.
Okay. So does it anything make you feel better? Are you taking any medication for the diarrhea?
So far, no, because I don't know what medication to take, and
Okay.
also, I just feel better if I don't eat. If I don't eat, then I'm fine.
Okay. But doesn't that like if you don't eat you will feel like weak or so?
I sometimes feel a bit weak and then a bit tired out lah because I keep going to the bathroom. So
I see.
it kind of bothers me throughout the day.
Do you drink large amount of water?
I try not to because I don't want to go to the bathroom because I already go to the bathroom to have
Yeah.
diarrhea.
I see. I understand. So how do you think this diarrhea affect your daily life?
Quite a bit. Since 2 days ago, I feel like I haven't sat pretty well. I just, go to the bathroom and it just is not good for me and my work
Yeah.
now.
So has it gotten worse over time, like becoming more frequent, or have you noticed any blood in the diarrhea?
So far there's no blood in terms of worsening. I just feel more symptoms over the days. I just feel like it's getting worse.
I see. Alright. I take note of that. Okay, so I would like to ask other symptoms. So do you have any like nausea or any vomiting?
Yes, I have, because I go to the bathroom quite a lot.
Okay.
I have like a bit of nausea. Vomiting not so much. Just after I eat, occasionally I would vomit it out, but it's not that bad.
So you would vomit how many times a day?
1 to 2 times a day.
1 to 2 times a day. Is it like after mealtime? It's
Mostly
not
after mealtime, especially after lunch. Yeah.
I see. Okay. So the quantity of the vomit. So is it like the food content or is it watery?
It's mostly food content.
The color of the vomit, is it like brownish or greenish or any blood?
There's no blood, but it's just food, so it looks
I
like the
see.
color of lava. I'm not quite
Alright.
sure.
I understand. Okay. Do you have any fever?
I think I had a mild fever about 3 days ago.
Did you take any temperature at home?
I did, but I don't remember, doctor.
I see. Alright. So have you been taking any medication for the fever?
I just took Panadol, once or twice. Once I feel like the fever came again, I just
I
took
see.
Panadol.
Does it relieve the fever, the Panadol?
Yes, it does.
Alright. And then it comes back.
And then it comes back.
So you started yesterday, right?
I started yesterday.
Yeah. The diarrhea started 2 days ago, right?
2 days ago. Yes.
Okay. So other than fever, do you have any chills? Like you feel cold at night, you were shaking?
Right.
No, okay. Do you have any abdominal pain?
And my lower abdomen a bit, yes, doctor. Because I keep going to the bathroom, and every time I have diarrhea, it feels
Yeah.
a bit painful
I
there.
see. Is it like cramping or just like
It's
discomfort?
very, very cramping and discomfort as well.
I see. Okay. Alright. Have you been having any headache?
Headache. Once I had the fever a bit, but now not so much, doctor.
I see. Have you been taking medications or anything that would reduce the headache?
I just go to sleep, then it gets better.
I see. Have you noticed a rash on your body?
No rush.
No. So, any pain behind the eyes or you cannot
No
see
pain.
the light? No pain. So lah. Alright. So any signs of bleeding, such as you can see your gum bleeds or purplish color discoloration on your skin, any bruising?
Not that I know of, no.
Okay. So have you noticed any fogging activity at your household area?
No,
Your tahu
I
perumahan?
don't think so, yeah.
Okay. So have you have muscle pain anywhere?
Where? No, I don't think so.
No lah. You just feel weak, is it?
It's very lethargic.
Okay, alright. So I would like to ask a few questions on your past medical history.
Yeah.
So do you have any high blood pressure?
No.
Do you have any diabetes or cholesterol?
No, everything's good.
Okay, have you had similar symptoms in the past like this?
A few years ago, yes. Once I had outside food, I remember
Okay.
having this time same kind of diarrhea, explosive diarrhea, but after a few days it got better lah. This time it just hasn't got better.
I see. Okay. So you don't have any other medical conditions?
No, not that I know of.
So have you had any surgery in the past?
No.
No. So you have not been hospitalized in the past? Alright, so is there anyone in your family that has been having same issue?
My family no, but my colleague yes.
Okay.
Yeah, and he complained of the same diarrhea and vomiting for the last couple of days because we
I
ate at the
see.
same place.
I see. So he has been having the similar symptoms.
Similar symptoms.
Alright. So other than Panadol for your fever, have you been taking any other medications?
No.
Okay. Have you taken any traditional medications?
No.
Do you have any drug allergy?
I don't think so. No.
Okay. So what's your usual diet like?
I work a lot, so I think
Okay.
I don't have time to cook. I usually go out to eat. Most days I go out to eat.
Okay.
I rarely eat at home. Mostly fast food.
Do you usually regularly eat at the stalls, like near the roadside?
Yes.
I
It's
see.
near to my work, so it's a bit easy for
I
me.
see. Alright. Okay. What about your sweet intake? How little you consume per day?
What is it again?
Fluid intake.
Fluid intake. Again, I work so much, I don't remember to drink water. So I think about only a bottle of water each day, one
I
liter. I feel like
Okay. What do you work as?
I'm an engineer.
I see. Okay. Are you married?
Not yet.
Okay. So are you currently living alone?
Yes.
Okay. So may I know like how often do you eat out?
Almost every day. I don't know how to cook and yeah.
Okay, I see. So that could be a problem because you always eat outside food regularly and it might increase the cause of infection and stuff. So have you traveled anywhere recently?
No, sometimes so far I'm on a break from traveling.
I see.
Yeah.
Okay. Have you do any come in contact with any contaminated water? Have you go to like sungai or any public pools?
I'm too busy for that.
I see. Okay. Alright, so this question is a bit sensitive, but I have to ask. So, do you smoke?
No.
So, do you drink any alcohol? Do you take any recreational drugs?
No.
Are you sexually active?
No.
Alright. So, I'd like to ask the questions about your period. So, may I know when did you first start getting your period?
At 13.
At 13. Okay. So, when is your last period cycle? Last time the period came?
Last month. Like,
Last
it
month.
comes every month, so it's fine.
So it's normal.
It's normal.
Alright. So may I know, do you have any ideas on what could be the cause of your diarrhea?
I think it's just the food I eat. I'm not quite sure, but
Because you're having vomiting too, right?
I'm having vomiting too.
Okay.
But it's quite weird because I eat at the same place, but never had the same symptoms before. So
Okay.
I don't know.
Alright, so do you have any worries that you might want to tell me?
I'm just worried that I cannot do my work properly because I keep
see.
going to the bathroom.
Okay. Alright, so yeah, so based on your history and based on what you described, sounds like you may have an infection in your stomach, or we could call it acute gastroenteritis. So you're probably from consuming contaminated food or water. So there are other causes that we need to rule out. So we might need to do some physical examinations and also some investigations. So I would like to proceed with the physical examination first, if that's okay with you. I would like to check for your any abdominal pain or your abdominal area. Is that okay?
Yeah.
Alright. So Sheikh Altar, I'll be taking some of your vital signs, your blood pressure, and also your temperature. So if you have any pain or any discomfort, just let me know. So I'm going to take your temperature. So 38.5. So I'll be taking your blood pressure. You can just press your hand here. So have you been taking any caffeine or before you come here?
No.
So your blood pressure is fine. It's around 180/70. So I'm going to get you to lie in the bed. I'll see inside your abdominal area. Alright, so first can I have a look at your hands first? Right. Okay, can you do that please? Okay. So can you pop your glasses? I'll check your eyes. Okay. Can you open your mouth? Alright. Can you lift up your tongue? Okay. Just take one Monica. Bukan juga. Bisa kita dalam sikit. Okay, ini kita nafas. Hembus. Nafas. Hembus. Nafas. Hembus. Nafas. Hembus. Sambungkan ke dalam dalam. Ini sekali. Sikit lah. Sebab sisa sikit. Sekejap saya keluar lagi tahu. Cucuk. Cucuknya kat sini boleh? Sini dengan sebelah dia boleh check. So saya akan paru-paru cekap pertama. Lepas tu saya akan cek kaki untuk tengok ada cakap lain. Okay, so based on your history and also physical examinations, it highly suggests acute gastroenteritis, and also because you're recent intake of outside food and all. So to confirm what's causing diarrhea, however, we need to do a few others investigations, and we also need to rule out some other differential diagnosis. So what we'll be doing first, I'll be needing to take your blood today. So to do some full blood count to check any signs of infections, and also I may need to take your for stool culture to also see any bacteria or parasites that are present in the stools. And then I will send some serum electrolytes. This is to check for any renal impairments, and also because you have been vomiting, also having diarrhea, so you might be having some electrolyte abnormalities, and then probably other inflammatory markers such as CRP and ESR. So that are some of the ones that I'll be sending. So once we get the results, now we can determine what's the best treatment for you. So yeah, so in the meantime, just make sure that you stay dehydrated, and also avoid consumption of outside food for the time being. It's better for you to just cook, and then we'll keep a close eye on your symptoms. Okay, just let me know if symptoms are improving anytime soon. Alright, so yes, there we go.
Thank you.
Welcome.